Good morning, everybody. Today we will be discussing Kuhs Community Medicine Paper 2, February 2016. Question paper answer key discussion. A man aged 50 years comes to outpatient dispatchment department with history of cough, irregular fever, chest pain, and at times hemoptysis for past 2 months. Answer the following. What are the possible causes? History of cough, irregular fever, chest pain, at times of hemoptysis also. This blood in the cough is called hemoptysis. What are the possible causes? How will you diagnose this case? State the method of managing the patient. State the objective of the management. The possible causes: tuberculosis, carcinoma lung, pneumonia, occupational lung or bronchiectasis. Cough for 2 weeks or more means we have to look for algorithm of TB. 2 sputum years, 1 or 2 positive, then 2 smear negative, sputum smear examination, then smear TB negative means smear negative TB, anti-TB treatment we should start. 2 negative means antibiotics 10 to 14 days, symptoms persist, and 1 or 2 positive, repeat the smear examination. 2 smear negative, chest X-ray negative for TB, positive means anti-TB treatment. So negative 2 sputum smears we should read. So algorithm of TB you should go thoroughly. Then sputum examination, methods of diagnosis: sputum smear examination, radiography, fluorescence microscopy with Oramin strain, then management of the patient. Category 1 treatment means 2 months of HRZD, isoniazid, rifampicin, ethambutol, streptomycin, and 4 months of H&R. Objective of the management: cure, prevent the complications, reduce transmission. Many cases of diarrhea. Second is a problem based 5-marker question. Many cases of diarrhea reported to a primary health center. List how will you investigate and how will you categorize the individual cases. What is the treatment plan and what are the preventive measures? So many cases of diarrhea reported to a primary health center. Verification of diagnosis, confirmation of existence of an epidemic, defining the population at risk, rapid search for all cases and their characteristics, then data analysis, formulation of hypothesis, testing of hypothesis, evaluation of the ecological factors, further investigation of population at risk, writing the report. Then categorization of patients. Category 1 means signs of no dehydration treatment, WHO plan A. Signs of treatment, some dehydration, WHO plan B. Treatment of signs of severe dehydration, WHO plan C, zinc supplementation. Prevention, improvement of sanitation, ensure safe water supply and safe food supply, personal hygiene, health education, immunization against measles vaccine, rotavirus vaccine, fly control. Then there has been reports of increased incidence of mortality due to coronary artery disease in your area. What steps will you take to situation in your area? So coronary artery disease mortality. So it is also a 5-marker problem based question. Baseline information we have to gather. Identify the high risk group for screening. Infrastructure development in hospitals. Strengthen of referral services, ensuring continuous supply of free NSCD drugs in the PHC. NSCD drugs in the PHC. Then strengthening of the NSCD clinic in sub-centers. Non-communicable disease clinic in the subcenter. Regular NSCD clinics in PSC and CSCs, lifestyle modification, monitoring and evaluation of activity indicators, number of screening gaps, health education sessions conducted, the nutrition days conducted, incidence of coronary artery disease, and the number of cases referred and treated, number of deaths due to coronary artery disease. Now comes the 4-marker question, iodine deficiency disorder. Primarily it includes goiter, hypothyroidism, subnormal intelligence, delayed motor milestones, mental deficiency, hearing and speech defects, strabismus, unilateral and bilateral nystagmus, spasticity and neuromuscular weakness, endemic cretinism, deaf mutism, myxedema, cretinism, intrauterine spontaneous abortion and miscarriage. So epidemiological assessment of iodine deficiency indicators are prevalence of goiter, cretinism, neonatal hypothyroidism, urinary iodine excretion, measurement of the thyroid function T3, T4 and the TSH. Then IDDCP, iodine deficiency disorder program. Components are iodized salt, iodine monitoring, manpower training and mass communication. Then comes vitamin A prophylaxis. Strategy, health and nutrition education, early detection and proper treatment of infections, prophylactic vitamin A as per the following dosage schedule. 1 lakh international units at 9 months with the measles immunization, 2 lakh international units at 16 to 18 months with the DPT, booster and every 6 months till 5 years of age. First 1 lakh international units at 9 months with the measles immunization, then 2 lakh international units at 16 to 18 months with the DPT, booster and every 6 months till 5 years of age. Sick children, all children with the serophthalmia are to be treated with health facilities. All children with having measles to be given 1 dose of vitamin A if they have not received in the previous month. All severe malnutrition to be given 1 additional dose of vitamin A. Then oral rehydration solution. The composition of ORS in gram per liter contains in gram. Sodium chloride, basically it is the salt that is available in our house also, 2.6 gram per liter. Glucose anhydrous 13.5 gram per liter. Trisodium citrate 2.9, potassium chloride 1.5, total it should be 20.5 gram per liter. Explain the preparation and administration of the ORS. Advantages, easily available, inexpensive, easy to prepare by mothers or the relatives. Now comes the health problems of the elderly. Problems due to aging, problems due to long-term illness, degenerative disease like cancer, accident, diabetes mellitus, psychological problems and social problems. Prevention, pre-geriatric care, health education and exercise, annual medical checkup, early detection, treatment. Then counseling and rehabilitation, welfare activities, then social assistance. Adolescent health. Adolescence is the age group of persons between 10 to 19 years. The following changes are taking place during adolescence: biological changes, cognitive changes, emotional changes and social changes. Biological, cognitive, social and emotional changes. Adolescent problems, high morbidity and mortality associated with adolescent pregnancy, poor understanding of their sexuality, sexually transmitted infections, substance abuse, malnutrition, emotional and behavioral problems, identity problems. Services to be provided, skill-based health education, life skill education and counseling. Then early diagnosis and management of medical and behavioral problems. ICDH and then differentiate between reservoir and source of infection. Reservoir in which the infectious agents depends on for survival. Reservoir is the infectious agent that depends on the survival, natural habitat in which organism metabolites and replicate. In bookworm infection, the reservoir is the man. Source means the person, animal, object or substance from which an infectious agent passes or disseminated to the host. The immediate source of infection may act as reservoir. In bookworm infection, source is the soil contaminated with larvae. What is the difference between emerging and re-emerging disease? Emerging disease means newly appearing infectious disease like Ebola virus disease, Zika virus disease, hantavirus, pulmonary syndrome, etc. Re-emerging means disease which were previously controlled by chemotherapy now developed antimicrobial resistance appearing in epidemic form. Example, syphilis, mad cow disease, resurgence of diphtheria in Russia. Difference between salmonella and the staphylococcal food poisoning. Salmonella food poisoning we will discuss first, then we will discuss about the staphylococcal food poisoning. Salmonella food poisoning, the agent is the Salmonella typhimurium and the Salmonella corypheus and Salmonella enterius. Incubation period is 12 to 24 weeks. Salmonella typhimurium is the incubation 12 to multiply in intestine, acute enteritis is the problem. There will be fever, nausea, vomiting, profuse watery diarrhea for 2 to 3 days. Staphylococcus agent is the Staphylococcus aureus. Incubation period short. It is 1 to 8 hours. Ingestion of preformed toxins. Staphylococcus is more dangerous. There will be ingestion of the preformed toxins. That will be associated with vomiting, abdominal cramps and diarrhea. And substantiate with the explanation. Legislation is the best method for preventing RTAs. People are aware of road traffic rules but are reluctant to practice. It should be tackled by legislation. The primordial prevention is the best method to prevent chronic diseases. Aims to prevent the emergence of risk factors which may be associated with the onset of more than one chronic disease. Example, smoking, obesity, and it is also a cost-effective method. List the following obesity indicators we are looking for. Obesity indicators is the body mass index, that is the Quetelet, Q-U-E-T-E-L-E-T, Quetelet index, ponderal index, Broca's index, Lorentz formula, and the corpulence index. Disaster management after earthquake. Disaster impact and the response, the relief phase, the rehabilitation, disaster mitigation, disaster preparedness. So disaster impact and response, relief phase is there. There should be rehabilitation, disaster mitigation and disaster preparedness for the upcoming earthquakes. Steps of the planning cycle, situation analysis, formulate the health problems, assign priorities among the problems, then assessment of the resources, define the objective and the targets, design the alternative program, select the best program, orient and train the personnel, implement and evaluation. That is PQLA, Physical Quality of Life Index, infant mortality, life expectancy at age 1 and literacy. What are the functions of a subcenter? Mother and child health care, family planning, subcenter clinics, disease surveillance and control of local endemic disease, sanitation, implementation of national programs, record keeping and reporting. The next question paper we will discuss in the next video.